Hey there, welcome to another video. This is an introductory video. We're gonna do more. Next one working on is tips on parenting children with autism. That's a great one. Um, just to help our parents that feel lost or that need help, that need strategies. And I'm also gonna do another video, another collab with my great friend, shout out to Mia, on emotional intelligence. Um, but we're doing this video as an introductory to spread awareness and sort of get into it. And I have here my lovely wife joining me.
Hi.
Just because we have children with autism. So she's gonna help me speak on this topic, you know? So happy to have her on. And we've created a little presentation just to help with a visual, um, pun intended, because children with autism are all about visuals.
Yeah,
So
visuals are very important to
yeah,
have.
they're all about it. So here it is. What is autism spectrum disorder? And what are the causes? And first thing is, it's a behavioral diagnosis. You know, it's not something that's induced by outer source or biggest example that in the presentation is not caused from bad parenting, different sources like that.
It's not.
Uh, sad to say, um, it was once believed, as you see in the 40s, uh, that was a misconception that it was just induced by, since there was a lot of misogyny, bad moms. Um,
Oh, come on. Right, Mom? That's crazy.
yeah,
That
so
is just crazy.
moms out there, uh, I want to say that I'm happy to live in this time, in
Yeah,
this era,
definitely.
thankful. Um, but yeah, it's just complex developmental brain disorders, and even that word disorders could appear as a label. I like to just think of like different avenues, different channels in the brain um, that gives um, them that credit when it comes to having challenges in everyday life and everyday um, grooming, caring for themselves, or learning. You have different complexities in the brain. We're going to go over some examples, but it can also be factors that are genetic. There's some studies do genetic testing biologically, it could pass down. And I'm already laughing because I, for one, could attest to that. I learned through the therapies and treatments that they're in, some things that they're working on that I needed, like cognitive behavioral therapy. Like I needed that therapy. I'm on that therapy just because of educational um, awareness on sensory um, factors. I get stimulated with certain things with like lighting. We need the halo light on now, but lighting could be a problem for me, and loud sounds as well. But different components and exposures, that's a conspiracy still. Um, we're not getting into that in this video because some conspiracy are like taking a jab, when we were children or our parents when they were children. So, you know, those factors could be in it. Whatever your belief systems are, some studies shown that those are factors, you know. So next is, every person with autism is unique. Right off the bat, we could say that every child is unique. All of our children, um, disabilities or not, of course. But when a person hears, when they don't know necessarily the fundamentals of autism, but they hear about it, right away labels come into play, and they might think that they're not smart or they're not aware, and chances are they're intelligent.
They're very intelligent.
Very clever.
Yeah.
Especially one of our sons, because we have twins. He's slick.
I was
He's
about to
slick.
say that. Yeah, they're very, very intelligent, slick.
Yeah.
We were even surprised as they
Yeah.
got older.
Exactly. And that's where the term spectrum comes in. It's just complexities, as we said. So it just comes into play where you might see some of them exhibit certain traits and certain parts of their personality, and it makes them unique. They're all different. They all have um, strong strong traits and attributes and challenges. So always keep that in mind.
There's different levels too of
It's
autism.
different levels. And some of them could be with motor skills as well. Some of them could learn how to put their shoe on easier than others too. So these are examples.
Like, for example, Marcos is a quick learner compared to Lucas.
Yeah.
In many things. But they're both very intelligent to learn different things.
He just retains it faster.
Yeah. Whether it's in school, tying their shoes, different areas.
Yeah. And don't get lost in the labels. Do not. It's hard as a parent because especially if you're just finding out that your child has this diagnosis, you're going to feel heavy emotions because you're defensive. You want the best for your child, and that's good. It's not a bad thing. And when you hear, the diagnosis itself, or if you share it with, loved ones or family, friends, people in confidence, their expression, the way they express themselves about it, their reaction, their response to it, it might make you feel bad, but it's okay, because you as a parent, you got to do a lot of research, and the labels aren't going to bother you. I mean, our sons were just diagnosed with ADHD as well. They're 6 now. And we found out when they were close to being 4 years old that they had autism. So we just learned it later on. And I was a parent that was very quick to be responsive and sort of be defensive. I had a barrier because that was what I was familiar with growing up. But you got to just have an open mind, and you got to do your own research, so.
Yeah, for me, when we first found out, it was surprising, but at the same time, I thought, wow, so many things make sense now.
That mother instinct too.
Yeah. So, you would see other children, learning things, doing things quicker than, our sons.
Yeah.
And you're wondering what's going on, you would notice different little things. And then when, a psychologist tells you, hey, your sons have autism or your daughter has autism, you're like, it's a lot of different emotions.
It's a label, but it's an answer as well.
Yeah. And it takes time for you to accept it, to, get used to the idea. And it takes time to learn many different things about it.
Even our sons playing in the playground, before we were aware that they had autism, they would play up close, because they're on the side of the spectrum where they're up close and hyperactive. They're not closed in and quiet. They're very talkative.
Mhm.
So they would get up
Yeah.
into kids' faces, and the parents would put an expression, and the kids would get startled. So
Yeah, the kids will be like
you
kind of,
know,
like scared, like, whoa.
yeah,
So, we have this thing where we tell the boys, hey, give space, give space. And then
hmm
they know that that's when they're supposed to, give space, step back, and, have respectful space between, the person and them.
and we even have our structure, if how to do things, activities, but we're gonna say that for the tips video. But really just try to just see your kids for who they are, what they do every day, and where their strengths and their challenges, and just go about that. Sometimes actions speak, so don't get lost in the labels. And it's okay to feel the bad emotions. That's something that I really wanted to throw in this video, so I made that
It's common.
part of the slide. Yeah, I mean, when you feel frustrations, when you feel by your child belittled or undermined, because they're just in a loop. We're going to talk about the behaviors next. But certain behaviors they have, when they express that to you, you're going to feel these emotions, and it's okay. You got to tell yourself, take time to just do deep breathing. If you're not a meditator, I wasn't, I'm certified now, but before I was just introduced into the whole wellness practices and, immersed in that life. I didn't take time. I internalized a lot of emotions because you don't want to express that in your child either. You don't want to raise your hand. You don't want to scream at them.
No, that does not help. It doesn't.
And we all have our days, right?
You have your good days, you're gonna have your bad days.
So if it happens, it happens. But you have to just break out of that cycle. You have to take care of yourself. Kind of self-parent. You gotta just do a lot of self-talk. Give yourself a break. Be lazy. Whatever labels you want to put on yourself. Self-care is important. And just really get involved with just emotional intelligence. I can't wait to touch on that with my friend. Really learn about the empathy side of letting your kids be independent, but when they come back, know how to be there for them. You have to just find the balance, because every child is unique.
Yeah.
Every child's unique. So we can't tell you what to do, but don't feel bad when you feel frustrations. Channel that energy, clap your hands, or punch something, punching bag, squeeze something.
Just be proud of yourself.
Arts, just be proud of yourself. You're doing a lot of hard work. Your child loves you.
Yeah,
you got to tell yourself that.
It also helps to see the achievements you've done, for yourself and your child.
And I even to internalize a lot. I affected my health. You become physiologically weak, when you internalize a lot of emotions heavy. I'm just learning now that I can't have a full-time job and be there for them for their therapies. I couldn't handle a lot, and it affected my health. I needed treatment. Lost a lot of weight. It's been a lot of struggles, but you become stronger, because you can't repeat the same thing twice, so always keep that in mind. And here we go, the behaviors. First off, we mentioned children a lot because for this diagnosis, it's usually noticed from being a few weeks old or months to the age of 3. Being that we have twins, we were naive, right? A lot of times we thought that they just had, bad habits with each other, feeding each other their own language.
And we're first-time parents, so we didn't have,
of course,
experience in the past with a child. So,
and us, but especially her, was doing her research, just really trying to like get that manual because it doesn't come with it. So we found out when they were close to 4, we saw delays mostly in some motor, but speech as well. And it's a long story, but we got them assessed. We'll talk about it in the next video. And we found out, so, and we're still learning. We're far from perfect, still learning.
Yeah.
So the behaviors could include hyperactivity, impulsivity, fidgeting, different routines and rituals that you could label as bad habits. But a lot of things stimulate their brain, and their brain is in constant need of stimulation that is amusing for them, that is therapeutic for them. So
music is therapeutic for them.
Yeah.
If you put like relaxing music, instrumental music.
Echolalia as well.
Yeah.
Echolalia, like they're gonna repeat same sentence twice in a row. So a lot of these things, it might be frustrating for you, it might bother you, but you gotta work around it. It's just gonna happen. Our sons still speak third person. They still say their own name, like if they're Elmo, and it's just who they are.
Elmo is a bad example, just so that you parents know. They're gonna learn to,
I mean,
say their own name just like Elmo does. So be careful.
Yeah, I mean that we believe that triggered it, but there are cases.
The therapist also mentioned that.
The therapist also mentioned that, Elmo most likely caused it. But their way of their brain, their channeling, is different. The views of the world, some things might be too bright. A lot of things might be too loud, and they might speak too loudly or too low because they hear things too loud. So a lot of these variations you have to be mindful of, and just simply ask them. Do not tire out of asking them how to do something to benefit all of you. You can't get tired. The way I visualize it, as like an endless rope. You just got to be an endless rope that gets them from point A to point B. You can't expect them to correct something that you want corrected. There's maladaptivity there too, with certain children in the spectrum. So, and as you read, different routines, different ways of playing, of being, eating. There's different therapies and different treatment plans that different organizations could offer your child. So always speak to a physician, to their provider, if you're comfortable with that, or just do research online for your own stuff.
I do want to mention that having a routine helps your child to live a happier and more organized life. That has helped us a lot. And children with ADSD, sorry.
Not ADHD, ASD.
ASD, children with ASD.
Yeah.
They have to have a routine.
They thrive in it.
Yeah.
That's true. Yeah.
So they could, know what's going to come next, because most children with ASD, they have trouble with like transitions, like our sons. One of them has more of a problem with transitions than the other one. So
yeah. And that feeds into the anxiety component as well.
We also have a schedule, a visual schedule, that they could look at, and they could see what's gonna come after what they're doing right now. So we're gonna say, hey, we just finished doing this right now. Look, we're gonna do this now. And that really helps them. Yeah,
and it's like that old joke of Charlie Brown's teacher. Most of the time, that's how they hear us. They get lost after a sentence sometimes. They just hear things in repetition, or they're thinking of a movie they watched. And you're just literally just wasting words. So visuals, that's great. Visuals help a
You can have
lot.
some in the bathroom showing, visuals how to, like each step of how to
Their
wash your
everyday
hands.
routines, yep.
Even to use the toilet. They also have visuals for that. Different things.
Eating, take a picture of them eating their food,
Mm-hmm.
taking a mouthful. And if they're like pocketing or if they're playing around or if they're just distracted and they're not eating, just point at the picture. They've seen themselves like taking a mouthful, and that'll encourage them rather than, words, especially scolding. It's just like loud reverbs, repeating bass noises, you know, for some children. So
Mm-hmm.
those are little tips with that. And research organizations, as I said, speak with someone that knows about autism, or their provider, and really advocate for your children. The more therapies, the more organizations that actually take them, occupational therapy, they take them into their facility, and they follow, the pandemic guidelines, and they learn motor skills, they learn um, everyday lifestyle, healthy choices like sharing and crafts and arts, playing with others,
Yeah,
following
our
instructions.
sons have trouble. They had trouble sharing. So we were actually
All brothers do,
yeah.
but I mean, they were like fighting.
Yeah.
They don't know. They don't know.
Every day, oh my God, so many times.
They don't know
One
any
day,
better. They love each other, but
yeah.
it got bad. The frustrations would just build up that bad.
And we saw the therapist like playing board games with them, and they would teach the boys how to take turns. At first it was difficult for the boys, but little by little we saw improvements, and it was amazing.
And all these facilities, they do assessments. So it's always different because they're really educated, to psychological components of everyone's brain, um, neurotypical or not. So they'll know what activities to do with your child that's best suited for your child. They don't play board games with every child that walks in, So that's just an example of how different programs and organizations really could go a long way for you, and it won't feel like hard work. The commute might be rough for you, but I mean, just seeing the magic that could happen and the bond that you could have for your child, that would definitely build up um, more space for that intimate connection with you and your child with that special need. So, and take a break the cycle mentality. I say that myself because I mean, just getting lost in labels and not trusting into the medical field. I mean, that's pretty much what was instilled in some of us, you know, that were in that generation of 80s, 90s. So we were exposed to that a lot. We've seen that a lot, but I mean, you have to just really see things for what it is, actions speak. And if you have struggles, whether it's in a relationship or if your child is having struggles and you sort of seeing yourself in your child, you can't get frustrated at your child for that. You can't try to get a sense of control with that. Um, if you're around people that are making you feel this shame or this judgment, I mean, it might be time to just explore just a healthy boundary, because you're already putting in at least 80% of your energy into advocating for your special needs child or children.
What comes first is you and your child before anybody else.
Yeah. So it's best to just thrive in an environment where you're child is getting what they need. And like I said, I discovered I needed cognitive therapy. You know, I was diagnosed with a sensory disorder as well. Um, I have texture aversion to certain foods since I was 5 years old. It's a lot of things, you know, that we learn sometimes to our children, you know. So
Definitely.
yeah, do your research. Do your research for yourself before anybody tells you anything about you or your child. Do your research for yourself. See how far it goes. And that's it. So we hope you enjoyed this video. We're going to be doing a new one, like I said, on tips of parenting children with autism spectrum disorder. Take it from us. I mean, we've gone through a lot of hardships,
Yeah, a lot of
separations.
But we've learned so much.
We've learned so much, and now we're just thriving just because of answers, you know, tools that we got from advocating for our children and ourselves. So stay tuned for more, and always leave an email. My email's in my bio, in my YouTube bio. Always leave us an email. Any questions or any shared experiences, any tips for us, please. And leave a comment and share to someone that you think might benefit for our tips on parenting children video. That one's coming up next. So stay tuned, guys. Take care. Be safe. Anything else you want to add?
I think we said everything.
Yeah. You sure?
Yeah.
Our little notes. You good?
Good.
She's good. Take care, guys, and see you guys soon.
Bye.